Good morning, everybody. I'm pleased to say that New South Wales continues its run of zero community transmissions, and pleasingly overnight we did have nearly 12,000 people who came forward to get tested. And it's always pleasing when we see those testing rates go up. It gives us confidence that the community is responding and that people with the mildest of symptoms are coming forward and getting tested or following health advice and making sure they're isolated until they get results or otherwise until health deems it safe for them to leave their homes. It is a positive position we're in, and therefore today I wanted to reiterate that if things continue on the path they are, that from Friday week we will be reverting back to the 2 square metre rule. So any setting now, whether it's a hospitality venue or a place of worship that's subject to the 4 square metre rule, will be reverting to the 2 square metre rule. So unless there is something very unexpected that occurs between now and next week, that is what will occur from Friday week. And I'm making these comments today to provide certainty to business, to make sure that people are prepared and can take advantage of that situation, barring any unexpected shocks or any unexpected outbreaks that may occur between now and then. This means it's really important for us to maintain our vigilance, to always be on guard, but I do also want to flag that we are considering our mask wearing policy in view of the position New South Wales is in. I can say that moving forward, mandatory masks on public transport will continue. We think this gives people assurance to get around their daily business, and to also, given the fact that you're in an enclosed space for a long period of time, just to maintain that level of assurance. But if there's no evidence of community transmission, we would recommend or revert back to previous mask wearing policy, but that's yet to be determined. So whether it's a hospitality worker or a place of worship, you still need to wear a mask until at least next week when we consider that position. But I do want to stress in relation to masks that many vulnerable people are continuing to wear the mask in all settings, and that's a good thing. If you are someone who's vulnerable or want that extra line of defence, that is absolutely your decision. And of course, all of us should wear a mask if we can't guarantee social distancing. If we feel we're in an environment, or if we feel we're in a situation we can't guarantee social distancing in those high-risk indoor settings, well then we should of course be wearing a mask. But I did want to flag that the 4 square metre rule to the 2 square metre rule, and also mask wearing in certain settings, will be reviewed next week with a view to announcing changes to be implemented Friday week. And I just wanted to give the community and give business that level of warning that unless there's a major issue that arises, that they can look forward to those opportunities. It's really important for us to bring the community with us. It's really important for us to respond to the risk. And if a certain period of time, the health experts tell us the risk is 0 to very low, well then obviously we can make those amends with the community. New South Wales stands by its decision to make sure we don't impose any burdens on our citizens a day longer than we need to. But having said that, keeping the community safe is always our priority, but so is keeping society running as normally as possible in a COVID-safe way. And anytime we can give notice and certainty to the community, we will. I want to thank everybody involved in the last month or so. It's been a huge effort by everybody to get New South Wales to where we are, and I'm pleased that obviously this year we can look forward to dealing with COVID, dealing with the pandemic, but also in view of the vaccine rollout and what that could mean for New South Wales. I'll now ask Dr. Chant to give her update, and then we'll take any questions. Thank you.
Thank you, Premier. So New South Wales recorded no locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 2 cases acquired overseas, bringing the total number of COVID cases in New South Wales since the beginning of the pandemic to 4,925. As the Premier has indicated, it was pleasing to see testing levels up, with around 11,816 tests performed to 8 p.m. last night. As complementary to our testing, we also have been expanding our sewage surveillance system. And last night we did receive a detection of in that sewage surveillance system in the Island Park sewage network, which serves about 88,000 people in the Liverpool catchment in southwestern Sydney. The catchment takes in suburbs of Cecil Park, Bonnyriggs Heights, Green Valley, Len Waters Estate, Hitchinbrook, Hoxton Park, West Hoxton, Carnes Hill, Hornsey Park, Edmondson Park, Bardia, Denham Court, Leppington, Glenswood Hill, Glenfield, Casula, Prestons, Varronville and Austral. Now, whilst we have got some cases that have recovered that are living in that area, those positive detections do call us out to call for the community to be particularly vigilant. So anyone with symptoms in that community, please come forward for testing. We are going to need to have the community continue to present for testing throughout the coming year, so it is critical, and I want to thank the community for their response. Thank you.
There were areas, including nightclubs and gyms, that were still out 4 square metres of outbreak. Did they remain?
Yeah, I have to stress that singing and dancing is still considered too high risk in the current environment, so those activities will still not be allowed, and clearly we'll take advice from health on those specific venues. But in terms of the vast majority of hospitality venues as we know them and places of worship as we know them, they will definitely be reverting back to the 2 square metre rule, and will provide further advice on those other increasingly high risk areas.
What about the caps on weddings and funerals? Will you ease those caps?
At this stage, that's not in our consideration. At this stage, what is in our consideration is reverting from the 4 square metre rule to the 2 square metre rule, and leaving weddings and funerals as they are.
Why is that though, Premier? Why being removed from the 2 square metre rule and offering person caps at weddings and funerals?
Because presumably when you attend a wedding or a funeral, many of the attendees know each other, and the risk of transmission in an emotional setting remains high, and we have to be alert to that, and that's based on the health advice.
Just in terms of universities, they're again saying that they fear they won't be able to start their recovery in 2021 because of international arrival caps. Is there any update on the plan to start bringing in students?
Well, obviously, National Cabinet meets on Friday, and these issues will be discussed. But the federal government's indicated their priority is returning Australians back home. A number of states have raised the prospect of international students. It's ultimately the decision of the federal government, and their priorities, as they've indicated, is that they want to prioritise returning Australians, and no doubt that will be discussed on Friday.
Do you expect the international arrival cap to be upped on Friday?
Well, as we've announced previously, all states took a pause from January 15 to February 15, so that's already been in the works. That the understanding was that after February 15, states would revert back to our initial caps. So New South Wales has been on 1,500 for the last couple of weeks, and until the 15th of February that's the case. But it was certainly the understanding of National Cabinet, unless there's a change in policy or a change in decision, that all states would revert back to their previous caps. But I would also argue that some states can do a bit more of the heavy lifting, and I would prefer that occurred as well.
Can we get an update on how the vaccine rollout is proceeding and what people can expect?
Well, that's really a matter for the Commonwealth Government. So we are also awaiting information from the Commonwealth Government on what we can expect and when. But I do want to say this: it's always been the policy of the New South Wales Government and our health experts to make sure we provide any information to the community that we have. I've said on a number of occasions that when it's my turn, I'll make sure that I get the vaccine. I think the more people that get vaccinated in a timely way, the better it is for our response to the pandemic. And we'll obviously have more to say when we're advised ourselves, and we look forward to the Commonwealth sharing that information.
So is it taking longer than you expected? I mean, we keep hearing that, we're still waiting to hear from the federal government. I mean, is that longer than you?
No, I think we'd always the federal government had always anticipated the rollout would commence February, March, and obviously our health experts are already in negotiations and discussions, and as soon as we have something concrete to convey to the community, we will. But I do want to stress that the policy around the vaccine rollout is the responsibility of the federal government, and of course we're here to support that in any way we can. And of course, as soon as we have anything concrete to be able to convey to the community, we will, but I don't have anything to convey at this stage.
So you've said time and time again that you want New South Wales to take less of the load for returning travellers. What power do you have to simply stop taking as many?
Well, I think what is really important is there are obviously, as the vaccine rollout continues, I think priority should be given to those jurisdictions and those workers who are looking after returning Australians. We know the quarantine system is our biggest risk across the nation, and I would like consideration to be given to states who've been wearing the burden of that to make sure we protect our communities as much as possible through the rollout of the vaccine and through protecting our quarantine workers.
So you mean that New South Wales should be getting it first?
Well, I would like to see New South Wales get its proportion based on the risk we're carrying. So obviously there's thousands of people involved in quarantine, and I would like to see that occur. But again, we're awaiting information on that.
Premier, what do you say to the hundreds?
I will be, yeah.
Premier, what do you say to the hundreds of families who've made harrowing submissions to the Rural Health Inquiry, claiming that they've had a lower standard of health care?
Can I firstly thank everybody for coming forward? It would be devastating to be a patient or to be a family member for someone who feels they've not had a positive experience in a rural or regional setting. Can I stress that I did get advice from health, and the best advice we have that in 99.9% of cases patients receive a very satisfactory and positive outcome from the health system, but no system is perfect. There are always learnings, and I again want to thank those families for coming forward and speaking about their experience, because that is the only way we can learn and move forward. Yes, mistakes will happen. Yes, there'll be issues that we need to address. Yes, can we do things better? Of course. Health is a very complex part of government. It's huge. It's the 1/3 of our state budget goes towards health, and I suspect this year it's been even more than that for obvious reasons. So I want to thank the families for coming forward and giving their experience, but I also want to assure the community that based on the numbers I was provided from health when I inquired about this matter myself, in 99.9% of cases patients receive a satisfactory and positive experience. But I do appreciate that when you're talking numbers, even that 0.1% equates to a number of families, and if there's more we can learn, we will. But I think it's very courageous and brave for patients and families to come forward with their experience, to make sure that if there are any learnings, we take them on board. And clearly the challenges of providing medical services in rural and regional settings are very different. They're not more or less, but very different to the challenges providing those services in densely populated parts of our community. And of course the New South Wales Government will consider any recommendations that come through that process. But I think first and foremost we need to thank the patients and the communities for coming forward with their experience, because that is how health can consider any recommendations and make any improvements necessary. But I say that in the context of saying that certainly as far as the statistics are concerned, the vast majority of people, especially compared to other parts of the world and Australia, receive a very good quality of care.
Can I just clarify something that you just said? Did you strike about the Western Australian Health Minister's comments yesterday about guards in hotel quarantine not being required to wear masks? Do ours?
Well, unfortunately, I'm not surprised, because New South Wales system has been tested, and Dr. Chan and I were asked about this question a few weeks earlier, and we can confirm that our policy now is that yes, all security guards must wear masks, and that advice is provided by, I can never remember the name of that committee, Kerry. Yeah, the Clinical Excellence Commission always provides states with that advice, and their advice from a particular point in time was that all guards should wear those masks, and certainly New South Wales adopted that policy. But that group, that committee, provides us with advice, and of course as soon as we get that advice we implement it.
Premier, just to clarify, back on what you said before about prioritising New South Wales, so you put this to National Cabinet on Friday. And
Yeah,
how do you think
it's and can I say it's not prioritising New South Wales. It's just making sure that New South Wales, because if we are going to continue to bear more of the risk, it stands to reason that we reduce that risk by making sure our quarantine workers are some of the first in line to get the vaccine. That's all I'm saying. It's not about New South Wales going ahead any other state, because obviously it's a national rollout and every citizen has the right, according to their category, to be treated respectfully and equally. All I'm saying is if some states are bringing in more Australians than others, obviously that carries risk with it, and we've always borne that risk. As you see, whenever there's an outbreak, community transmission being zero is the aim that all of us have, but the biggest risk to that is our quarantine system. We know that whenever there's been an outbreak, it's been linked to the quarantine system, so it stands to reason that they would be the category of person that you would look at providing the vaccine first and foremost. So that is a position I'll put, but it's not about New South Wales beating other states. It's just about making sure that the risk that is borne by people in those occupations in that front line is considered as part of the rollout.
How does that work? Do you want more jabs in other states, or do you want vaccines to be rolled out in New South Wales
faster and then rolled out in other states?
No. I think the national approach is the way to go. So every state obviously will be part of the same journey in terms of the timing. But we know early on when the vaccine rollout starts in various cohorts, if you're going to look at frontline health workers, if you're going to look at frontline people exposed to the virus, obviously people working in quarantine are the most exposed. And that's why it would stand to reason that if you're going to look at categories of people most at risk, you would be best to ensure that the vaccine is made available to everybody across the nation involved in quarantine. We simply have more of them because we will be welcoming 3,000 Australians back. And all I'm suggesting is if you're looking at categories of the most vulnerable and those most exposed, you should provide that, of course, across the nation.
Remy, your government's regional education plan being announced today, one of the key objectives is to increase and retain quality teachers, get quality teachers from the city to the bush. But regional schools will say that this has been, been trying to do this for years, and no matter what you do, you cannot seem to attract people to the bush. What's different about this plan?
I think what is different now is if you look at a school like the Armidale Secondary College where I visited last week, the investment we've put into bricks and mortar is encouraging people to move to towns and actually take up teaching positions. And one example I will give is when I visited Armidale Secondary College, there was a familiar face amongst the teaching staff, and I said, "I've met you before." She said, "Yes, I used to live in your electorate and I was a Girl Guide leader, and now I'm teaching in Armidale and I've moved here." And that's a classic example of wonderful education facilities, wonderful communities attracting good people. And can I firstly say there's so much homegrown talent already. So many people in our regional communities are choosing teaching as a profession, but I also feel regional communities are attracting people from all the larger cities as well for the experience, for the lifestyle. And also I think it helps when you're building so many new and upgraded schools, when you have a positive working environment, it does also encourage people to move into those locations. And nobody can deny, if you look at the facts, you don't have to look at our rhetoric, but if you look at the facts, the investment in rural and regional schools has not been ever like this in New South Wales, and that is also an incentive to encourage people to teach at those locations, but also the lifestyle opportunities. I think there's a real renaissance in our regional communities. The deep drought is no longer there. We've avoided this summer of natural disasters whilst many communities are rebuilding, and in many ways COVID has been impacted more heavily in our larger cities. So the regions are going through a very positive time, and that's why it's really important for us to renew our efforts to encourage jobs and encourage good quality people from the regions, but also from the larger cities to occupy these important positions.
I mean, is that your political second, Craig Kelly, had a good stoush this morning,
Oh, look, that's a matter for the Prime Minister.
So this has been subject to a HCCC warning, and so I also alert you to that website which has got previous details. But New South Wales Health's role in this was to assess whether there was a risk of bloodborne virus transmission because of the practices observed. The bloodborne virus panel assessed the risk as low to moderate and hence advised notifying patients. Now, because of the record keeping challenges, we were unable to get the accurate records, and hence we're complementing both directly contacting patients where we have those details, but also issuing a public warning to get that message out. It's quite a substantial period of time from June 2013 to December 2020. We are asking people to talk to their GP and to arrange a bloodborne virus test. And as I said, we think the risk is quite low, but obviously the significance is there if people are inadvertently exposed to those viruses through the practices at the setting.
Dr. Chan, could we get an update on the...
Go until the Pfizer vaccine apparently started running. New South Wales ready, New South Wales Health facilities ready to accept that?
We're certainly working incredibly closely with the Commonwealth, who is leading the rollout of the program. And every day we've got multiple engagements, and we're learning from the experience internationally in how to roll out the program. So yes, we are prepared, but it really is working hand in glove with the Commonwealth, who is the lead And obviously some of the key elements will be when we have vaccine available in country. We obviously have the TGA who's registered the Pfizer product, but there will be milestones of knowing when the product is actually in country, available for distribution, the volumes, and obviously the regulatory pathway that a couple of other contenders are pursuing, and that's in particular the AstraZeneca vaccine, which is still under TGA review.
Dr. Chan, has New South Wales Health...
I think that we would expect our regulator to be thorough and discerning, and I think that that's why New South Wales residents should have confidence when we're rolling out a vaccine that we have got a strong regulatory system in New South Wales and Australia, and that the TGA has approved the use of the Pfizer vaccine, and it is currently considering other vaccines.
Dr. Chan, has New South Wales Health cleared and...
So in New South Wales, we report the daily number of tests returned. Is that standard across the states and territories? Is that the practice that everyone adopts, reports the number of tests returned in the 24 hours?
Look, I would have to check, but clearly it's hard to... The way we have is we have an automated system where the laboratories upload electronic data and we report that. Sometimes that occurs in a batch, that the laboratories, both private and public. We obviously get real-time notification of any positives. So can I assure the community that if there was a positive test known now, we would be in the position of that had significance or a new case, we would certainly be alerting the community. So we get real-time notification of that. The rest of it comes in a batched electronic notification, and we report till 8 p.m. the previous night in that cycle. We also exclude any repeat tests. So our tests also exclude repeat tests, and our numbers also don't include our salivary testing that we're doing in our quarantine and other facilities.
The 11,800 or so tests you report in today's numbers, they directly correlate to the test, the cases, zero cases. There's no cases from 11,000 tests.
And so yes, that's correct. And then obviously... The reality is that is the most reasonable and accurate way. If I actually take you to our epidemiology report, which we publish every Wednesday or Thursday, you will actually see that that has additional information, which is date of onset for people tested. So the date of testing. So we break it down in multiple ways because we're obviously interested in looking at some of those spikes and delays in testing. But it's really pleasing to know that our pathology turnaround times have been actually very robust, and most people are getting their results within 24 hours and some within even 12 hours. So it is critical to reassure the community our turnaround times, and hence this has been a standard way we've recorded the information. But if people want to delve into some other detail about by date of onset of testing, date of collection of the testing, our epidemiology report does have that, and for other purposes we obviously look at those data as well.
And Dr. Chan, has New South Wales Health completed all the screening and cleared all returning travellers that came from WA?
So that's an ongoing process, but we certainly have not. Our contact tracing team has been contacting those individuals, requesting them to get a test, and obviously there is some time lag between that test being reported. So that's a progressive ongoing activity, and I thank the people that have returned from Western Australia for being compliant with both the directions and the requirements around testing. Look, I haven't had the opportunity to review that study. Obviously, we'll get briefed on all material that's emerging, and it's emerging apace. And so I think this is one of the factors that Australia's in a great situation, in the fact that when we're rolling out our vaccines, we'll be in the position to have learnt a lot from the experience in other countries around the world that have rolled out the programs. But certainly that's a key issue that we don't know as yet, what the impact on transmission. It will be actually very positive if it actually prevents transmission or reduces transmission. That will mean that we have a very good tool in preventing, in tackling COVID for 2021 and beyond.
Are we learning any more about the UK strain? We've now had 2 cases in the community of this in Brisbane and Perth, and there doesn't appear to have been mass spreading events. Is that reassuring to you, or do you believe it was just sheer luck?
I think we understand the reasons why transmission occurs are multifactorial, so they relate to the viral load of the individual, the innate properties of the virus, and so clearly there's concerns that some viruses are more transmissible, but ultimately it will also depend on the behaviours of the individual or the settings in which they're exposed. And so we can't really draw conclusions from just those 2 cases. We have to probably go back to the data that's being generated about their behaviours on a larger scale. But clearly every time we look at these cases, it gives us room to pause and contemplate and think about the best way to interpret these settings.
You sit on the AHPPC, Dr. Charles, were you surprised that the West Australian Chief Medical Officer didn't notify the AHPPC about a new local case in the community Sunday morning meeting, despite knowing about the local case 7 hours prior?
The conversations that occur at AHPCC are confidential. Obviously, we release any information to the public, so I've taken this position from the get-go. I'm not going to comment on discussions of what is raised or is not raised at AHPCC. All I can say is that we work incredibly closely across all jurisdictions in combating COVID because we know that people move quickly. And I would just like to acknowledge my colleagues in the other states and territories whom we regularly pick up the phone and have a conversation to and discuss matters, and it's incredibly important that we continue to work collaboratively.
Last few questions, please.
We've learned a lot in managing hotel quarantine and really responded to the learnings. Clearly ventilation's been one of those areas, and that's been looked at, as has the nature of the personal protective equipment, issues like where you position staff. So from every outbreak we've learnt new things. Every case in a security worker or a cleaner, we've learnt new things. And what's been pleasing is how states and territories and countries like New Zealand have shared those learnings in a very real-time way so that we can actually just check those settings are in place in our current quarantine system. We are still, I've got to say that we are still pursuing a few lines of inquiry, but we are looking to conclude the report probably in the next week or so. As I said, there are some final strands of investigation that are underway. Nothing has been identified to date, but as I said, there's been a process of looking at all of the avenues of investigation, and there's just 2 minor additional pathways that have been identified that we're pursuing and waiting for some results on. And then at that point, if there's nothing yielded by those investigations, we will have not been able to conclusively find the chain of transmission. I think it's not appropriate to speculate. We will be publishing the report as we do, probably as an appendix to our epidemiology report that we produce on Wednesdays. But as I said, we're just waiting for some further investigations, but to date we have not been able to. And I think that whilst that's disappointing in some ways, I think on the positive note, with the contact tracing, the support of the community, the response to both the Avalon and Barella clusters has been outstanding, and I'd like to thank again the community for their outstanding response. Oh, look, these are a matter for organisations, but clearly the setting in many countries throughout the world is very different from Australia. I think it is important that we understand how advantage we are in regard to our COVID settings at the moment in Australia. So yes, the risk is very high in most other parts of the world.
Premier, what do you make of Israel Folau returning to the rugby league with his senior track play?
Look, that's a matter for them. Well, let's just say we're looking forward to having positive news that day, for that day. Bye.